I'm Dr. Troy Spurl, and our podcast is Synapse Snips. Our podcast teaches people about how the body is supposed to work, basically how we were innately made. Have you ever wondered why you get headaches? Ever wondered why you wake up and your feet don't work in the morning and they're achy, and then as you get walking, it gets better? Have you ever wondered why you don't remember your dreams? Have you ever wondered why you're gaining weight even though you're eating right, you're exercising, and the weight keeps coming on? Have you ever wondered why you're just feeling depressed? It's hard to get up off the couch. If you ever wondered about why you feel these things and why you're not just feeling right, listen to our podcast to get the answers. We get to the root cause and we tell you why. Make sure you're listening to Synapse Snips each and every week, where we answer the questions that you guys have. Also, you can find us at officialsynapse.com. That's officialsynapse, synapse.com.
Hey everyone, it's Dr. Troy here from Synapse Snips, and I'm joined today with Dr. Josh Wallert from Synapse and Dr. Luke Moja, who is one of our affiliates down in Jacksonville, Florida. So thanks for joining us today. We are going to be talking about chronic fatigue and fibromyalgia today. So this is a panel discussion about just what we've been seeing and how we have been dealing with it. It is coming in more and more often. In fact, I just had a patient that came up all the way from Georgia to work on this exact scenario. 31-year-old, beautiful person inside and out, but just completely taken by the chronic fatigue part of this. So, Dr. Josh, you just want to start us off and just talk a little bit about chronic fatigue and fibromyalgia, what they are and how they interrelate?
Yeah, for sure. I feel like these are two topics that are kind of misunderstood because they're such blanket statements or blanket diagnoses, right? If you go and ask somebody, well, what causes fibromyalgia and what causes chronic fatigue syndrome? It's like, well, I mean, it could be lots of things. And if you go to a medical doctor, they're not really going to tell you one way or another. So, I mean, we see this all the time because they come along for the ride with so many other chronic disease states that we see. Whether it's a hormone issue, a mitochondrial issue, whatever it is, people will get fatigue, people will get pain kind of as a side effect almost of these other issues. And so they go to the medical doctor, they'll just give them this blanket diagnosis and maybe a medication and maybe not. And often it's just, hey, kind of deal with it. We don't really know what causes it. Of course, for us, we have a lot of tools that can address both of these issues.
Yeah, we see with a lot of these, there's obviously very much a sleep disorder linked. And I'm just going to say it this way. If anyone is sleep deprived, you're going to be sore, right? Your muscles are not going to work. And so I know, Dr. Luke, you've got a lot of insight on this and a lot of personal experience. You want to talk a little bit about your story and how it relates to chronic fatigue and fibromyalgia?
Yeah, definitely. So I was actually diagnosed with chronic fatigue syndrome before they found out I actually had Lyme disease. So I think that's, like Dr. Josh was saying, I think it's kind of a diagnosis of exclusion when they can't figure out what's going on. They just tell you have chronic fatigue or fibromyalgia. But I think, yeah, from what I've seen, a lot of times there's a combination of stressors that can cause this, or maybe one big stressor. That could be something like a chronic infection, like it was in my case, or I know when I started having issues, I didn't just have that. I had a lot of other stressors in my life at that point, and I think it just kind of tipped the scale until finally developed that chronic fatigue state. So I think it can be a combination of different things, whether that's physical stressors, environmental toxins, chronic infections are big parts of it. A lot of times, Dr. Josh mentioned the hormonal issues. It can be thyroid, adrenal issues can be going on. A lot of maybe like an emotional stressor or something like that can also play a role. So I think there's a big combination of different things that really kind of set the stage for a diagnosis like this.
Yeah, I really want people to hear that it's not just one thing that's going to cause either scenario, but conceptually we can kind of package this up so you can understand it better. So at some level, you're not actually recuperating at nighttime. So you're not getting into that deep restorative sleep. And whether it be your actual mitochondria that's compromised or just a REM sleep disorder, you're not able to actually get the restorative component to allow your system to work properly. And then we start to see people get stuck in what we call fight or flight, which is very much going to trigger an emotional component to how you live life. and they don't get into rest and digest. So you see digestive system get compromised. And what I am going to talk about in a little bit is just some of the things that we've started to see, regardless of what the root cause is. Restoring that foundational component is so key. So the foundational lifestyle, so getting sleep restored, improving the barrier of the gut lining is very, very important. Dr. Josh, being a functional neurologist as well, can you speak to a little bit as far as just how much our brain impacts the lining of the gut?
Yeah, I was going to say too, it's so interesting how much of a spiral this can turn into.
Yeah.
Or you can have this stressor, it'll shut down your sleep, which will impact your nervous system in the fight and flight, and that just kind of gets you going out of control a little bit. From a brain perspective, then, if anything is causing inflammation in the brain, you're going to disrupt that balance between your fight and flight system, the sympathetic part of the nervous system, and then the rest and digest, that parasympathetic. These aren't consciously controlled, but at the same time, everything that we do and think can impact how that system works. And this is where like the emotional trauma and even just day-to-day stress can play a big role here. And if that system's imbalanced, the vagus nerve in particular, which is going to be the main kind of rest and digest output of the parasympathetic system, that doesn't work very well. And the vagus nerve is going to control gut function, among other things, swallowing and heart and lung function. But without that vagus nerve, the gut slows down. There's poor blood flow there. You set up leaky gut really easily, and then everything else can kind of come from there. If you get overgrowth of bacteria or fungus, that's going to cause the inflammation and make things worse. This is actually why in head injury, I don't remember the exact statistics, so someone can check this, but it's between 75-85% of people that get a head injury will end up with a leaky gut.
Yeah.
Just because of the impact on that part of the nervous system.
Yeah, and this is so important because one of the things you just said there, the blood flow is reduced to the gut lining. So even if you're taking nutrients, you have to fix leaky gut from the inside of the gut and the outside of the gut.
Yeah.
The vagus nerve and the blood flow. And one of the things that we do here at Synapse, and then also Dr. Luke does this down in Jacksonville, we'll look for a physical disorder. It's called upper airway resistance syndrome, where the head and the airway is not quite working properly, and the airway actually collapses at nighttime. This sleep disorder is extremely common with fibromyalgia and the chronic fatigue syndrome. In fact, it's the upper 90 percentile of people that we've treated all have that. And we use certain chiropractic adjustment where we reset the occiput, and that can help with some of the blood flow so that you can get the nutrients to the gut lining. And you could be diagnosed with leaky gut, but also one of the foundational things that we've been focusing on lately is this MT barrier. It's a metallothionein barrier. It's a part of the lining of the gut, and it's very much zinc dependent. So as these people, like in your cases, Dr. Luke, if it's Lyme that set that off with like some lifestyle or some life stressors, we tend to get into this fight or flight, and it down regulates our ability to absorb key minerals like zinc. And so we end up losing this barrier, and then copper starts to go up and other heavy metals go up. And we've seen historically, especially in functional medicine, a lot of practitioners will treat the heavy metals, but if you don't fix the lining of the gut, you don't get better because the metals will just keep coming from the food supply. So that zinc and that metallothionein barrier is very, very important. And just to let people know how important it is, this is the same barrier system, and it might not be full-blown leaky gut. It's just one part of the barrier system. When this is compromised in young kids, autism is one of the end results of that. We also see people with OCD and other anxiety and depression disorders can come from that type of scenario too. So the lining of the gut is so crucial for the correction of fibromyalgia and for the chronic fatigue when it comes to just overall improvement. And as you said, Josh, we see this with concussions, and it doesn't even have to be a physical trauma. It can be emotional trauma. Mm-hmm. People get ulcers from stress. So tell us a little bit about some of the things you did, Luke, to help yourself, and then what you would do for patients that you see with chronic fatigue and fibromyalgia. What are some of your gems?
Yeah, one thing, definitely. I mean, addressing the Lyme, the chronic infection was a big piece of it, but many times that's not enough. I think people get too focused in on, just killing the microbe or whatever, using the antimicrobials, and like you were saying, they don't address things like the nervous system, like the gut lining. So it's things like that have really helped. I know a lot of things. That's a lesson I had to learn big time with the nervous system too, because I would try all these things, for my gut, like L-glutamine and bovine immunoglobulins and colostrum and things like that should help and maybe would help temporarily, but it was like I could never, really get that. It would keep coming back. I would keep getting, the SIBO and the leaky gut stuff coming back and all that, because there's that nervous system component that, wasn't being addressed like it should. So that's one thing I want people to definitely understand, is that if you don't get that nervous system component, straightened out, like we were talking about with that sympathetic parasympathetic balance, the sleep and everything, you may get some temporary relief and make some progress, but you're never really gonna, be able to get over the hump with that. So definitely focusing in on that is a big part of it. And just addressing the stress. I mean, the stress is a big part of it too. A lot of people don't realize how much that's affecting them, and that plays into that nervous system component as well.
Yes. Sorry, Josh, go ahead.
I was just going to say, I mean, that's probably because we see a lot of Lyme disease and we see a lot of related issues, mold and such. I think the stress and the trauma is probably one of the most overlooked issues.
Yeah.
People come in and they just I think that's part of our society too. We kind of just say, it's going to be fine. I'll drink a couple of cups of coffee. I'll feel pretty good. It doesn't matter if I'm too stressed. That's got to be, for me at least, one of the top issues that people just ignore is the stress control component. Just because, like you said, I mean, how many times have you had people come in and they've already thrown the kitchen sink at stuff?
Yeah. And
it's just a matter of, you have to orchestrate that with the lifestyle balancing approach too.
Yeah, and it's not just one thing, because that's you have to do these things in concert. It's one of the reasons why at Synapse and down in Florida, Dr. Luke will also use programs. You get it from different angles. We look at the blood chemistry, we look at the neurology and the sleep. We track those things while we're kind of getting it from the inside and the outside of the intestinal lining, just for that one part. With fibromyalgia, you tend to have other issues like an inability to detoxify properly through the liver and bowel system again. So it's not just let's get the sleep restored, let's get the digestive function restored as far as the leakiness of it and stopping the influx of these metals and other environmental chemicals, but can you get rid of the acids through the kidneys and the liver and the inflammatory components so that your muscles and nerve endings aren't being bathed in these acids that are a byproduct of the original insult. And one of the things you said, Dr. Luke, that was really, really crucial for people to kind of learn. You can go after the infections, but again, it's important to get your foundational stuff established so that, especially when it comes to your barrier system, because your immune system uses zinc a lot. And if you're constantly stimulating your immune system to go after the infection, but depleting your body of the zinc in the lining of the gut, then you're kind of robbing from Peter to pay Paul type of scenario. So paying attention to a lot of those foundational stuffs while you go after infections is very, very crucial. And Dr. Josh, can you speak to what we know as far as just specifically with Lyme as the cause? But sometimes when you just go after infection, it can actually cause the infection to burrow down, is one way to say it, or go deeper into the cells. Can you speak to that a little bit?
Yeah, I mean, we see that a lot with the antibiotic use, with there being 3 different kind of life stages of Lyme, so to speak. Different types of pharmaceutical treatments are going to impact those 3 levels differently. And so if you give kind of a standard pharmaceutical like doxycycline, that's the one that's given as frontline treatment, which early onset is fine, and it's worth doing that if you recently got a tick bite.
Yeah.
But especially for chronic infection situations, this is kind of you get a temporary benefit because you give doxycycline and you might drive the Lyme to a different life stage, and you might symptomatically feel better. And this is really why when people do get even acute Lyme, I think it's 50%, 75% of people have symptomatic benefit from the doxycycline, but there's a large amount of those people that will regress after that ends.
Yeah.
And that's exactly why. It's not that it didn't work to a point. It's just that you've got a select group of those infections or those microbes then that either were resistant to it or they went and hid, and then they're just opportunistic. It's amazing how few bacteria you need in a Lyme disease situation to actually cause problems. It's not like a strep throat thing where you've got bacteria crawling all over the place. You just need a couple of those Lyme bacteria in select spots to really tick off the immune system to set off this problem. So being selective, and this, we don't do a lot of antibiotics for chronic Lyme as our first stop for this reason. I mean, you really want to improve immune function, improve the hormone and stress situation. Antibiotics are kind of the last thing we add as, just in case it's needed. It's not always needed. And Dr. Luke, in your experience, have you had to use antibiotic treatment very often in your Lyme disease history?
When I was first diagnosed, I went through a pretty intense program. I actually did IV antibiotics, and it did, like you were saying, it kind of gave me a temporary boost to kind of turn things around. So I was in pretty rough shape when I was first diagnosed with Lyme. So it did help as far as, turning the situation around. But I did notice that, there were a lot of things, other things kind of going on, and the symptoms eventually kind of returned. I was exposed to mold, later, and that plays a factor in it as well. So
bad 1-2 punch.
yeah, that's all. You kind of hear that combination a lot. And, I did the genetic testing and everything with the HLA testing and all that. And I had like the worst, one possible. So I think, having that is another thing that can kind of make you more susceptible to that combination of mold and Lyme, especially. So that's definitely something you gotta look at as well.
Let's educate our listeners on that a little bit. So there are certain HLA genetics that make you more predisposed to mycotoxin illness, meaning some people genetically can't clear these toxins out as efficiently as other people. So then you have to actually support your system a little differently. And I'm also want to just bring up what you said, Dr. Josh. When he's talking about life stages, he's talking about like the Lyme or infections like this can go into a cyst form inside the cell. And it's important for people to know the intracellular mechanisms that help stimulate your immune system inside the cell to clean it out are zinc dependent again. So this is not a show on zinc because there's many other factors, but I want people to know that, again, if you're depleting your zinc, if you're having issues with fight or flight and you lose your stomach acid's ability to actually be produced, which is zinc dependent, you actually don't absorb zinc as well. And I say this because the last person I assessed, her zinc was so low, and you start to lose that intracellular immune response as well as the barrier system. So that's just one factor. Many other inflammatory things can cause the chronic fatigue and fibromyalgia, but generally speaking, people have lost their ability to either clear something foreign, like an infection or an environmental chemical, or are stuck in a fight or flight state where their sleep have been compromised and they can't restore, especially if these people are younger, like in their 20s and 30s. And we're seeing a lot of that. And I'm just going to throw in one other caveat here. We have seen since the COVID era that there's been a down regulation of memory T cells. And so these memory T cells, when they start to become lessened, we start to see things like Epstein-Barr virus become reactivated, which is the virus of mono, which causes chronic fatigue as well. So it's very important for us to reestablish the immune system response as we're exposed to a lot of these life stressors.
Yeah, I wanted to mention something on that HLA piece because this gets into another kind of topic called CIRS, chronic inflammatory response syndrome, that we see a lot. And in a nutshell, basically, and you kind of said this, it's an issue where whether it's from mold or from infections from Lyme, it can even happen from spider bites and types of algae. You get a toxin in your system or debris from an infection that your immune system can't identify. That's what the HLA thing is, right? It's basically an identification mechanism on your immune cells. And in 25% of people, they've got some sort of genetic change or error in that system. Of course, I bet our populations probably have 80% of the people we see probably have that. We do that testing a fair bit through LabCorp.
Yeah.
And for anybody interested, there's a website called myhousemakesmesick.com. I've got to pull it up right here. That's where you can go in and kind of learn more about these different genetics. And some of them are multi-susceptible kind of genes, like Dr. Luke said, where you can just, regardless of the stressor, your immune system's not going to handle certain toxin loads well at all. Some are more specific. But because of that, this is where some people will hear the term chronic Lyme versus post-Lyme, and same with the mold situation. You can have had, especially for Lyme disease and infections, you may have dealt with that infection fully, could have killed it, your immune system could have done that job. But if you have the debris sitting there that you can't clear, your immune system will still think, there's still a problem here. We still have to go and clean this junk up and create inflammation and create a problem. And you have symptoms just like you had the infection, even though the infection's gone. Yeah. So that's, I think, an important point. People really are interested in that genetic piece because it helps to explain certain people's levels of just kind of chronic like susceptibility and just sensitivity to some of these issues.
So I want to speak to that a little bit too, because I just had a patient who has such a unique history, but they have a genetic susceptibility to an amino acid decline that affects lung health. Well, they ended up getting mycoplasma infection in the lungs because of that. There ended up being a downregulation of their immune response. They ended up getting a prostate infection. It was dealt with antibiotics, but then the prostate itself remained inflamed. So it was treated in the traditional world like BPA, benign prostatic hypertrophy, or BPH. And so, but he started developing fibromyalgia, chronic fatigue, because he couldn't sleep through the night and got all these fibromyalgia symptoms. And we've done a ton of investigating. They've looked at the actual prostate. It's being actually assessed as we speak to see if there's an active infection going on. But the only inflammatory markers they have is interleukin 1, interleukin 6, and tumor necrosing factor. And those are historically cytokines or inflammatory markers that go up when the venous system is having a problem. And what we have found is these smoldering inflammatory reactions, even though the infection's gone, in the bladder or prostate, get into our circulatory system, and these inflammatory markers will make their way to the brain, because the brain is the highest consumer of blood volume in the entire body. And even so, think of these inflammatory markers like little embers, and they actually make their way up to the brain, and we start to see cognitive neurologic problems, pain syndromes, inability to sleep, inability to recover. And the reality is it's an inflammatory mechanism coming down in from their lower abdomen. And we do see this in the hospitals with elderly patients who get like a UTI. Memory loss is one of the first things that they start to experience, but it's because of that circulation issue. So there are many different causes to that. It took us a while to figure out his root cause and what was going on. And I'd like you to speak to that, Dr. Luke. I want you to talk about the frustration being come out of doctor mode for a second, go into patient mode, and talk about some of the frustrations in dealing with something like this when it comes to healthcare. And did this lead to your decision to become a functional medicine practitioner?
It did lead to my decision to becoming a functional medicine practitioner, and definitely my own journey. Definitely everything I've learned from going through that myself, I wanted to use that knowledge to be able to help others who have gone through or going through similar experiences. But I'd say probably the most frustrating thing is just kind of the roller coaster ride. I would say you start to kind of get better and then it gets worse and you just don't really know why. And there's all these different factors that can be in play. Like I said, I had the Lyme issue and then the mold exposure, and there's been so many other stressors and things along the way that it's kind of hard to, determine sometimes, okay, I had a few months where I felt really good and felt the best I felt in a long time. And then it seems like all the symptoms kind of come back again. So I think just that can be the biggest frustrating part. It's kind of like, oh, am I ever going to actually get over the hump on this? And you start to experience that feeling of, oh, I'm able to live my life again. And then, a few months later, the symptoms are back. And I think that's the biggest frustration, I would say, that I've dealt with personally.
Yeah, you're not alone there. The reason I bring that up is because that frustration can lead to actually future worsening of the problem. So I want people to, I've always said this, if you know you're on a roller coaster, it's not as scary. If you don't know you're on a roller coaster, the ups and downs of a roller coaster will freak you out. And so it's important for people to know if you have this diagnosis, it's tough. You have to manage the thoughts of the ups and downs, and when you have an up, just be grateful. When there's a down, don't judge it. Don't get frustrated. Just know that there's something to continue to work on. And I used to say every time early on, because I was used to getting like complete remission of a lot of things. And then we started seeing these chronic fatigue fibromyalgia scenarios, and it became frustrating as a practitioner too. And I used to say, every time I think I know the answer, God changes the question. And that's kind of what it's like when it comes to something like this. Every time you think you're done, some new nuance comes in there, and we continue to learn as practitioners. So it's like a dance, but the patient's body is in the lead. Where we have had success is when the patients are on board with that and they embrace the downward trend of the roller coaster ride, and then start to not judge it, but just look at it as a neutral event and gather that information to find out, okay, why did this downward trend happen? What happened mentally, chemically, physically, or spiritually to basically have this become the next step? And you will gather another answer, which then gives you another piece to the puzzle to learn how to live life and improve quality of life, because there's always an answer to every one of these problems.
Yeah, this is why with our programs here that we do, we want to be not just going after like the infection. Like Dr. Luke said, we can't just hyper focus on one thing. It's so easy for people to forget the basics.
Yeah.
Like, are you like the sleeping right, eating, the air you breathe, the water you drink, are your bowel movements appropriate? Are you trying to move to a degree? Obviously that's tough in a chronic fatigue fibromyalgia situation. Yeah. But sometimes people will come in wanting to do the exotic tests or do the exotic treatments, and it's like, hey, you're zinc deficient.
Yeah,
you know, it's something easy. Because how many times now we've been testing zinc and copper more frequently now that we've been on this topic. Man, I don't remember the last time where I've had somebody come in where they've had normal, like normal adequate zinc and copper balance. Like, it's so rare.
Yeah, I have not had one, not this year. So not with any of them. And I'm ordering a lot of them right now because of this exact scenario. So so that is well said, and it can be very frustrating for people. So I want, if you have chronic fatigue or fibromyalgia, or you have a friend who has it, send this video to them, and if you're their friend or family member, just know that it is such an emotionally challenging scenario just to be experiencing this. And a lot of times, and you can speak to this, Dr. Luke, but a lot of times these people are living life and they look normal. You can't tell how much they're actually struggling on the inside when it comes to the lack of energy, especially the ones who are trying to gut it out in life. And we've had, to your point, Doctor, we've had to bring in people, specialists within our organization, just to deal with the emotional side of this. Yeah. And then also we have these things that we do here at the Synapse called the clearings, or neuromuscular reeducation. Dr. Luke also knows. So he's one of a handful of people, doctors around the country, who's been trained in this. This is a technique I developed years ago for post-traumatic stress disorder, but there's application here when it comes to these patients because of the pure level of trauma their body has gone through. And so that NMR process becomes very, very relevant. Do you want to speak to that a little bit, Dr. Luke, as far as just how people really don't know what's going on the inside and you look okay on the outside?
Yeah, I would say, especially like in the early days when I first got sick, and the labs all come back so-called in the normal range or whatever, and people are like, oh, this, I'd say got gaslit by many doctors, and I heard a lot of things of, oh, you're fine, it's all in your head, go home and eat some ice cream or whatever, you'll be fine, kind of thing. So I heard all kinds of things like that, and then people would see you and you're like, oh, you don't look sick, kind of thing. And especially the people that I definitely lost a lot of weight. I was an athlete before I got sick and everything, so I had a lot more muscle mass and everything. So the people that knew me before that kind of saw me and they're like, oh, like, what's going on? But the people that didn't know me at that time and had only seen me, after I had gotten sick and lost weight, oh, no, you look great. You don't look like you're sick or anything like that. So it's been, you hear that a lot, which, like, okay, it's like they're trying to compliment you or whatever, but it in your head, you're like, okay, these people don't really know they don't understand how bad I feel. And I think that's a big frustration with it as well. It's just communicating to other people how bad you actually feel. I mean, there've been many times it's like, I'm just frustrated because people are like, oh, just get up and go, do something fun or whatever. It's like, I don't feel like doing anything, it's like, it doesn't matter what I look like. And so, people have good intentions, but you can't communicate to people how you're actually feeling inside. So I think that's a big frustrating part of it as well.
Yeah, it feels like salt in the wound, right? Just a little bit of salt in the wound, even though their intentions may be good. One last thing to just kind of discuss before we wrap up here, but you mentioned something just about you just don't have the motivation to get up and go. There is a component of this, and Dr. Josh and I have spoken a lot about methylation in the past, and there's a component where your methylation, specifically your neurotransmitters, the serotonin, dopamine in particular, become impacted. So we've got neurotransmitters, we've got adrenaline, we've got cortisol, serotonin, dopamine. It is rare for us to have a problem with leaky gut or the MT barrier and the diagnosis of chronic fatigue or fibromyalgia without having a methylation issue as well. So do you want to just kind of speak to that a little bit, Dr. Josh, as far as methylation, neurotransmitters, and some of the links that we start to see?
Yeah, it's a small topic.
Yeah.
But one of my favorites.
It is actually.
Yeah, it is. I have genetics that compromise that system, so I'm well acquainted with the nuance there. But without going into too much detail, I mean, it's essentially your methylation cycle, like you said, it's kind of doing a few things. It's building molecules that are needed for energy production and detoxification, and it's helping you do some modifications of DNA and such. But it's super easy to break. And to become inefficient. Genetically, obviously, a lot of people have this issue genetically. It's the MTHFR gene, and there's other things related to that. Some people have heard of that issue. But just with even then going back to the gut issue, if you're not absorbing things, your methylation cycle needs a whole bunch of B vitamins. It needs protein. It needs it's magnesium and zinc and all these different other cofactors. It's easy to break because there's so many things going on.
Yep.
And when it does, then you start to, again, snowball, where the neurotransmitters, dopamine in particular, really stops working very well. Histamine can build up, and that causes, mast cell-related histamine intolerance issues. And then you don't make glutathione. And glutathione being kind of your fire extinguisher for all this inflammation and a primary detoxifier. So looking at that issue is a big thing that we do. And some people, unfortunately, just can't tolerate doing a lot of the targeted approaches to methylation right away because they are so compromised. So some people will come and say, well, I can't take B vitamins. Every time I take B vitamins, I feel lousy.
Yep.
So you just kind of have to try to go a different route. But that's really a common theme that we see is issues with methylation, and then a bit of a juggling act getting that to work again.
Yeah, I had a patient out of state that came in and said the exact same thing. They've been working with a very good functional medicine provider, but it was the same thing. I did some initial testing, found the sleep disorder, and she had an intolerance to B vitamins, intolerance to zinc. And so she had tried all these things, but did not have good reactions. And so I walked through how that happens, because some people they're stuck in that methylation pathway where they're at the same time undermethylated for part of it and overmethylated for another part of it. So if you start to support part of that process out of balance, you're going to feel lousy. Mm-hmm. And so there's an art to this, and you really have to understand not just the methylation pathway, but do they have a sleep disorder? Do they have any type of leaky gut? This particular individual had already done the lab testing ahead of time, and they did not have leaky gut, but they had LPS toxicity, which is a form of damage to the intestinal tract, and the lipopolysaccharides can act like an infection, but it's just flaking off of the intestinal lining. And so we have to reestablish we're doing some testing to look at her MT barrier system, but to your point, there are certain things you have to foundationally get established, zinc and copper and the MT barrier, before doing the methylation in many of these people. Mm-hmm. And a lot of these people have sleep disorders because of the methylation imbalance, and you have to fix the sleep disorder and get them sleeping to help fix the methylation imbalance.
Yeah.
So the diet, the routine, all of it becomes very, very important. Mm-hmm. And I'm going to say one thing. This woman was so used to being in pain and suffering. The first words out of her mouth with everything was, "I can't."
Yeah.
And I get that, but she did at the end of it say, "I have hope," because I showed her a path biochemically. So sometimes I'll pull out the whole biochemistry of what we're dealing with and show them along with our protocol, along with some of the physical stuff that we do, but show them how to help manage and mitigate this, knowing that there's going to be some things that cause a flare up, but it doesn't mean you stop there. You just have to course correct. And that's why, like people working with you, Dr. Luke, or with you, Dr. Josh, it's important in these two disorders in particular, fibromyalgia and chronic fatigue. It's really important to do your research, but really important to walk alongside someone who can help navigate it. We're really like Sherpas navigating up a really steep mountain when it comes to this. And so just know that there's going to be multiple curveballs along the way. And I used to say when I first started that I don't have the answer to every problem, but you won't find anyone that won't work harder for you to help you figure that out. And that's why we've had success with people from all over the country and all over the world. And so, and why we've onboarded people like yourself, Dr. Luke. So why don't we just wrap up with Dr. Luke? First, let's just have you give us your information so that anyone who's listening to this, who's in the Florida region or even within a couple hours of Jacksonville, can look you up. So how do people contact you?
So my practice name is Hope Spring Functional Wellness in Jacksonville, Florida. You can go to our website, hopespringfunctional.com. That's probably the best place to go. We're on social media as well, so Instagram and YouTube mainly. So if you want to go check out some of the videos and posts and things, but best thing to do would probably be to go to the website. You can get more information there, just hopespringfunctional.com. We work with people in person and virtually, so a lot of different options there. So yeah, just go check out the website, probably be the best way to get in touch.
Yeah, especially for people who are struggling with this, working with a doc who's actually been through it. And Dr. Josh, I know you get methylation like no one I know. And you openly spoke about how that was one of your issues. And Dr. Luke, same thing. So you can relate to people. And one of the things I've heard time and time again is that patients just want a doctor that won't give up on them, that'll walk alongside them through the entire process. And that's what this is, because it is a process, and to have a doctor who gets it, can walk alongside of it. I'll know you'll be blessed by working with Dr. Luke or any one of our affiliates. But for all of the listeners out there, thank you for listening. Dr. Josh, thank you for joining us. Dr. Luke, thank you for joining us. I pray this finds you well out there, and anyone suffering from fibromyalgia, chronic fatigue. If you have a family member, give them this information, because it can be the start of a healing journey for them. So God bless, and thank you all for tuning in.
Thank you for listening to the Synapse Snips podcast. If you like what you heard, subscribe to the podcast and share the podcast. To learn more, check out our website at www.officialsynapse.com. Until next time, this has been Synapse Snips podcast. We'll see you on the next episode. This podcast is for information purposes only and should under no circumstances be considered medical advice or a substitute for medical care. Any information given in this podcast is not intended to diagnose or treat any disease and is at the user's own risk. Please first consult a licensed healthcare professional.